Hello, this is Instructor Angela Goodrich, and today I am doing Lecture 1, Phlebotomy Technician Certificate. And so, Chapter 1 begins by discussing the healthcare settings and the role of the phlebotomy technician. And so you would know that the healthcare setting is wide, vast, different places that the phlebotomy technician will work: hospitals, nursing homes, labs, doctors' offices. The phlebotomy technician can work as a medical assistant in the doctor's office by just being the one there collecting the blood specimens. So today we are going to talk about the various healthcare settings that the phlebotomy technician would work in. And here on chapter 1, page 1, it talks about providers. And they're the ones who will be pretty much providing the care in the organization, providing the health care for the patient. A facility is described as a place where the patient will receive care, such as a hospital, a doctor's office, clinical labs, and treatment centers, nursing homes. Sometimes the phlebotomy technician would come into the nursing home to collect the specimens, or the phlebotomy technician will go to the hospital on the floor or in the particular area where the patient is, like in a doctor's office, to collect a specimen. Page 1 also mentions the payers. These are the ones who will be paying for the services of the phlebotomy technician. And so when the patient comes in to perhaps a doctor's office or a facility, they will check the pay source first. So most times the phlebotomy technician doesn't have to be checking that information. Most likely it'll be checked by like the front office or someone already in administration. Patients will depend on or will need various lab tests, blood draws, just to help the doctor with the diagnosis of the patient. So that's another word here on page 1 that you'll need to know. The diagnosis of the patients, the doctor gives that, and your role as a phlebotomy technician would be very important because you have to help collect the specimens, and from those specimens, the results helps the physician to diagnose the patient. So, as I said, other healthcare settings are inpatient or outpatient settings. That's on page 2. And patients can receive this care in acute settings, in subacute settings, nursing homes, doctor's offices, various settings, ambulatory care units, outpatients departments. Those are places where the patient can be and the patient can receive a specimen. Patients can also be in their homes, and a phlebotomy technician will go to their home or to their work offices to collect specimens as well. So on page 2, all the way through, you would find more information about the various facilities, and the healthcare setting that you're mostly familiar with is a long-term care environment. And as I said, the phlebotomy technician will go to those places as well to collect the specimens. I recall the phlebotomy technician coming into the nursing home very early in the morning to collect the specimens for the patients. You'll also find phlebotomy technicians in clinical labs. Patients might go to the lab to get their specimen drawn. You might be very familiar with that, whereby you go to the doctor's office and then they send you to the lab. Or you will go to another separate independent lab like Quest Diagnostics or Concentra, and they'll have a lab there. And so the phlebotomy technician will go there too, or they're working there to collect the specimens. Interestingly enough, I also know that they collect specimens from blood centers where people go to give blood. So on page 3, in Objective 3, we're talking about the organizations and the functions of the clinical labs. So the clinical labs are really there to collect the specimens and process the specimens. So when you, as a phlebotomy technician, go to a patient, you will eventually take the specimens to the lab. In the hospitals, they'll take them to the lab. In the nursing homes, the phlebotomy technician will go collect the specimens and then take them to a lab. Or some labs, you're just there and you get your specimen drawn and they're already in the lab, so they'll continue to process the specimen in the lab. There are labs that are controlled by the government or given permission by the government to conduct labs. So many nurses now, they have labs, mobile labs. Here at our school, we have a mobile lab, and that's called Good Nursing's Lab. You probably don't know about that, but there you can also collect specimens. Joint Commission is one of the accrediting agencies that continue to monitor and monitor the compliance of the lab, because of course you know that the lab has to be monitored and kept according to certain standards, and of course that's a little way above the technician, but after the patient is diagnosed or when the lab finds specimens that are questionable, especially diseases, they would want to further report those to Joint Commission or CDC so that these numbers can be caught and logged and recorded. Chemistry, on page 4, chemistry and hematology are two very important words that you want to know as well. The chemistry area of the lab, this is a department that works to analyze the blood and other specimens, and they would be the ones to look at the contents of the blood or the specimens and help to identify the various pathogens or labs or chemistries that are in the blood, and are the specimens like bacterias or viruses. They would look at the various chemistries that are there, and they would report those. Hematology is another department in the lab, and that's a department that is used to assess the processing of the blood, how the blood clots, the contents of the blood, the different types of cells that are found in the blood. So the hematology department is another area of the lab that will help with the diagnosis of patients when they identify these areas in the blood. So you see here on page 4, they have organizational structure for the lab. They have a lab manager, there's the technicians and the consultants, there are the clinical consultants, technical consultants, and the testing personnel. Those are the medical technologists. And then you see the phlebotomy technicians there, and they're the ones who will go out and collect the specimens and bring them back to the lab and get the patient's items identified. Microbiology is another area in the lab, and microbiology, they kind of go through the specimens, blood, stool, sputum. They'll go through those specimens and help to identify and analyze the microorganisms that they'll see. So this helps the doctor to diagnose the patient. Very important. Another area of the lab is hematology. In this department, blood and other body fluids are tested for different factors such as antibodies that may affect the body's response to disease. So that's another area in the lab. The blood banks, you know about those. Those are the ones that will collect and group and type the various bloods that come in. Pathology is another area in the lab. They're the ones who will focus on collecting and preparing specimens. When the patient has an operation, they may take a specimen from the skin or a tumor, and they will take it to the lab, and that department of the lab will analyze that specimen and help the doctor to decide on a diagnosis. Cytology is another department that helps to examine the structure of a cell, and that's another distinct department. Urinalysis, this department looks at urine. That's another specimen that the phlebotomy technician can collect and bring into the lab. So those are some different areas of the lab. Of course, you know the healthcare team, that's one of your favorite subjects, right? And so the healthcare team that comprises of the patient, who is the most important member of the healthcare team. And then you have nurses, doctors, all kinds of nurses, all kinds of doctors. You have activities people, you have various therapists, you have the dietitian, you have the pharmacy and the pharmacy technicians, you have nurse practitioners, all different kinds of doctors you will see as the healthcare team. But always remember that the patient is the most, and their family are the most important members of the healthcare team. I say that all the time. Had it not for the patient, there's no need for us, right? So always acknowledge that the patient is the number one person for you. Let's look at some other terms as described on page 7. You have the chain of command. You're familiar with that. It helps you to identify and to know who to report to should there be a problem. And some other terms that you want to remember, liability. This is a legal term that means someone can be held responsible for harming someone. So those terms that we're very familiar with, patient abuse, they don't go away. Patient's rights, they don't go away. So let's discuss and touch on some of them. You know, you have verbal abuse, you have physical abuse, you have sexual abuse, financial abuse, and patients have rights. They have a right to be treated with respect. They have a right to be treated with, if they refuse something, that's okay. If they say, I don't want a blood draw today, you know, you have to acknowledge that and report it to the nurse. Of course, you will do your documentation and so forth. So, yep, those things do not go away. If you see any abuse or if you're held responsible for abuse, you want to report that and you want to let whoever know, your supervisor, you want to let them know if there is a case of abuse. Scope of practice, that's on page 7 as well. A scope of practice defines the task that the healthcare worker is allowed to do. So as a phlebotomy technician, you are authorized to do certain things. Drawing specimens, drawing bloods, not doing IV draws, not doing PICC line draws, not drawing blood from a port. So those are some things that you do not do. But as you go along in the class, we will teach you those things that you can do, those skills that you can do, and that is within your scope of practice. On page 8, they go on to talk about the role of the phlebotomy technician. So let's pay attention to that. Drawing specimens, collecting specimens, and processing the specimens and taking them to the labs, those are some of the responsibilities. Those are the primary responsibilities of the phlebotomy technician. The phlebotomy technician will collect specimens of blood required for screening and for diagnosing the patients, and they have to know the lab draws, the order of draw, how to collect each specimen, and we'll be going through that with you in the class. They'll have different kinds of draws. They might have a syringe draw, they may have a venipuncture, and there'll be all different kinds of equipment to use to collect the various specimens. It's very important that we follow the rules of collecting blood or any other specimens, because if we do not follow the rules of collecting the specimens, if we do not collect the specimens and process them correctly, then there can be a misdiagnosis of the patient. So you want to follow the rules and regulations for collecting any specimens that you're supposed to collect. Like I said, you can collect specimens in doctors' offices, in the hospital, in clinical laboratories, in the blood donor centers. You can collect all those specimens. You can collect specimens in the nursing home, and you have to follow the rules and regulations of collecting specimens and traveling with the specimens in your car. You have to bag them up really well. So you have to follow the rules of doing such. Otherwise, by the time you get to the lab, the specimen might be wrong or might be bad. So you want to make sure you follow those rules. Most venipunctures are done by, most blood draws, I should say, are done by venipuncture or puncture of the vein with a needle, and there are various sizes of needles. And then there are capillary sticks, that's a dermal puncture, that's on page 8. That's another way of collecting specimens. And the phlebotomy technician is responsible for making sure that the tests are collected safely and correctly, so that by the time it gets to the lab for processing, it is a good specimen. Phlebotomy technicians are also responsible for making sure that the specimen is of the highest quality. Therefore, they have to follow the instructions. They have to collect the specimens correctly. Working together with the patient, working together with other members of the healthcare team will help you to do so. Creating a clean, calming environment. Of course, when you're going to collect the specimen from the patient, they might be anxious. There might be a lot going on. If you're working in the emergency room, you go to collect specimens there as well. And so there might be a lot going on in the emergency room. So you as a technician have to put that aside, have to make sure the environment is nice and calm for your patient so you can get a good specimen. Ensure that you have the right patient. That is very important. Safety. Identifying your patient before you start to collect. Identifying your patient, following the steps of identifying the patient and to collect that specimen. If the patient has questions before or after your collection, you want to take the time to explain. And if you're not able to explain the question or give the patient an adequate answer, then you want to let the nurse or the doctor know that the patient has questions. And if the patient has questions before the specimen collection, you want to have the nurse or the doctor talk with the patient first before collecting that specimen. You want to closely follow the correct collection procedures for each type of test. Every test will have specific directions, and as you go through the class, you would learn the various collection procedures for the particular specimen. You also, as a technician, have to observe infection prevention precautions and procedures. Hand washing is always going to be the number one choice of controlling infection. You have to implement your standard precautions, your transmission-based precautions when you go to see the patients. Patients might have immune suppressing diseases. That means they can collect or they can get an infection quickly because their immune system is poor. And so as a phlebotomy technician, you may have to put on your PPE when you're going into the room just to protect the patient. Not only to protect yourself, but to protect the patient. Protecting patients' health information is another very important role of the phlebotomy technician. As a phlebotomy technician, you have to respect patients' privacy. Patients have a lot of various diseases and stuff going on with them, and so you want to make sure that you follow the signs.